So the scope is a procedure that we do for patients when we're trying to evaluate cough or difficulty swallowing, voice changes. We're looking for something that's causing a sensation of something stuck in the throat, congestion, hoarseness, nasal irritation, etc. So the scope procedure is booked as a half-an-hour slot because we will talk to the patient at first, get more of a history as to what brings them in, why we're examining with the scope. The scope takes less than 5 minutes to do, about 60 seconds to do, to evaluate from the nasal cavity down to the level of the vocal cords. And then once the scope is done, we talk again so we can come up with a treatment plan together. So the scope shouldn't hurt. You will feel some pressure as we advance the scope through the nasal cavities and downward. We do advise our patients to use Afrin ahead of time, which is a topical decongestant, to make it more comfortable. During the scope procedure, we advise you to do things to monitor that your vocal cords are doing as they're supposed to. We ask you to cough, we ask you to clear your throat, swallow, we ask you to count really fast, we also ask you to sing. The reason for the scope, once we're done with the procedure itself, is now we're trying to find more answers towards your diagnosis, whether it's reflux or vocal cord dysfunction or chronic sinusitis, or you have some sort of vocal cord lesion, postnasal drip, or polyps in your nasal cavity or along your vocal cords. We'll have a better picture once we've done the procedure.